P.E.I.'s top doctor is once again planning a fall booster campaign against COVID-19. The Chief Public Health Office anticipates as summer winds down and people start to come inside, the respiratory virus season will begin. Dr. Heather Morrison said the province is starting to see more cases of COVID-19.
We're still tracking the numbers of cases that, and of course we don't get all the cases because of how we test. But we certainly are tracking our hospitalizations, which have gone up slightly over the last couple of weeks. Okay. We have we're tracking our outbreaks. So our outbreaks have gone up. Number of outbreaks have gone up, for instance, in a long-term care or community care facility over the last couple of weeks compared to the last few months. So we've noticed that difference. Our Paxlovid prescriptions, which are an indication of those who might benefit from Paxlovid seeking those prescriptions, those numbers have also gone up in the last couple of weeks. Noticing a slight trend that has started with our wastewater. So those all would indicate that it's starting to go up.
There are two strains on the go this season, the BA.286 and the EG.5. The plan is to match up the COVID-19 vaccines with the influenza vaccine. People can get one in each arm at the same time when they become available. This year's COVID-19 vaccine is recommended for everyone, of course, but especially those who are more susceptible to severe outcomes. Those 65 and older, those living in long-term community care, those who have underlying health conditions, and those who identify as First Nation, Métis, and Inuit. The SaltWire asked Morrison if she anticipates bringing in a masking mandate in the general population or in specific areas such as healthcare facilities.
That's a conversation we'll certainly continue to have with Health P.E.I. and the private community, but at this point there's no indication of a mask mandate. But we certainly know masks work, right? And
they sure don't.
So I think they have an important role, but it'll be also one. Putting a mask on in certain locations is doing that individual risk assessment, making sure people wash their hands, but also staying home if they're not feeling well.
Reporting in Charlottetown for SaltWire, I'm Dave Stewart.